Sketch. So it's my approach to the first guy, okay, trying ice cream for the first time. Experience a brain freeze. He's like, all right, everyone. I just created this delicious treat. It's frozen. It's called ice cream. I'm trying it for the first time. Right now. Here we go. It's amazing. Oh my god! It's the best thing I've ever had. I'm gonna eat it as fast as I can. I'm gonna eat it fast. I'm just gonna eat it. So good. Oh my gosh, it's delicious. Oh my god! Oh my god! Somebody kill me! Kill me! Hit me with a brick! Oh my god!
Okay, a little comic relief to start off the lesson. This is an actual kind of acute headache, cold stimulus headache. Yeah, I got the definition from Wikipedia. Storm days are tough. Anyway, it is a cold stimulus headache. Trigeminal headache. Trigeminal. That sounds suspiciously familiar, doesn't it? So, nerve pain caused by cold stimulus, and it's a reality if anyone has ever had one. It's pretty bad. But there are some other kind of instantly horrible headaches which we don't want to miss either. And we're going to talk about common ones in a minute here. But as many of us know from, just reading and thinking about this over the years, kind of the thunderclap headache that comes out of the blue, worst headache of your life, band around the head, totally sudden onset, usually with some other neurologic signs. I actually saw a professor of mine in my undergrad program collapse in front of us from a subarachnoid hemorrhage. I believe that's what it was in her case. But any of those acute brain insults where there's hemorrhage in the brain, a rupture of an aneurysm, I think that was her case, something like that, is going to give that horrible headache that's an emergency and not going to be something that you're going to deal with in an ordinary office setting complaint of headache. So, of course, we're going to go to the guideline, and we're going to, again, I know this is getting a little tiring, but we're going to think of the location when we ask our patient our questions. We're going to think about how the headache presents to them in terms of its symptomatology, its onset. We're going to think of a lot of things. We're going to age stratify patients, but we're going to think about location in terms of where the pain is on their head, and we're going to try to divvy those things up. So I'm going to take you to the guideline here. Like any good guideline, this is filled with very useful algorithms, and if you open the PDF document like I've done here, you can actually click through and go to the various algorithms. The diagnosis algorithm is kind of where we, of course, we want to start in our case, and this gives us all of the kinds of things we want to think about in terms of their history, and kind of taking us from ruling out by our history or a physical exam any of the causes for concern. For you and I, those would be our do not miss diagnoses or do not miss problems. And I want to make a note here that we kind of talked about that severe headache that's new and different, worst headache ever, and its maximum severity at onset. Now, the ice cream headache doesn't really count as a cause for concern, but the ones that I described earlier in terms of sudden thunderclap headache is certainly of concern. The other thing of note here that's very important for us in primary care is that if we see onset of headache after the age of 50, those people get a full workup, and we exhaust all avenues to be sure that they do not have something bad going on, like tumor, as one of the biggest things that we think about, or other causes of intracranial pressure. Most of the headaches that we talk about that are common, such as tension or migraine headaches, start earlier in life and thus are less concerning in terms of seriousness. Of course, any neurologic signs or presence of seizure take us to the worried list, or the worrisome list, and we need to have consultation immediately. So again, if we have causes for concern, we go to secondary headache. If they are meeting criteria for a primary headache disorder, we go into the algorithms here and evaluate for the common kinds of headaches, including migraine, tension type headache, cluster, and then chronic daily headache and other headaches, various headaches. I really appreciate on this page the notation here that sinus headache is often a mislabeling, if you will, of migraines. That a lot of people who think they are having sinus headache, it's really a migraine. And I find this very, very interesting and important for us to understand. So I'm guessing that many of you in the room know what these two common episodic headaches are like, the two on the top at least. We'll talk about cluster in a little bit. Most of us have experienced some kind of headache in our life. If you haven't, congratulations. But they do differ somewhat, although there is quite a bit of overlap. And I have read in other sources that that one of the ways that providers often tease out a treatment plan or a diagnosis even of migraine over tension type headache is not only its physical characteristics such as the unilateral throbbing character of a migraine versus the kind of pressing, tightening, moderate intensity and bilateral location of the tension headache, but that and of course we also know that migraine usually has either nausea and vomiting or some photophobia and phonophobia. Those are kind of the number 5 and 6 criteria on this list on the left on the top. But I think the other piece that's kind of not, it's hinted at in this algorithm but not really presented frankly, is that if people are losing days of work or school because of headache, they really need to seek treatment for prevention of the headache, and it's usually means that it's probably a migrainous headache versus the tension type, mostly because of the severity, I think. So this lays it out pretty clearly for us, and I think most of us know this. As far as aura, migraine can occur with or without aura, and aura being a sensation that the patient experiences prior to the onset of migraine. And they may have sensations of taste. They may have sensations, visual sensations that they see, and they may hear sounds. So there are, and they are reversible. They only last about a minute or so. Now, there are other types of migraine, such as visual migraine, or sometimes I've seen in children kind of a belly migraine, where they really don't have a lot of head pain, but they have visual disturbances, which again do go away, but they can be very debilitating. You can be driving along in a car, and all of a sudden you're having a visual migraine, and basically your vision is impaired. All you're seeing is white spots in front of your eyes, and it can be very distressing, very frightening. Anyway, so these are the annotations in this algorithm about that, and then they take you to treatment. So this is a busy algorithm for the treatment of migraine. I'm just going to make a couple of comments about it, and you can dig into it yourself and follow the clicks to look at the various treatment options. I will say that by and large you'll see triptans used a lot for both mild, moderate, and severe, and even some severe cases of migraine episodes. You will see the over-the-counter medications used by patients very successfully. Ergotamine is quite old and has been around and been successful in the past. We don't see it as much. Later in the text, the guideline is very clear that opioids and barbiturates are not indicated for rescue medications for migraine. We'll talk next semester about preventive medications for migraine. I'll not touch upon that here, but people are going to take preventive medications for migraine to avoid them, especially if they are having several episodes, again, interfering with work, school, or play. And so we want to consider that. DHE is a medication that, again, it's one of the ergot medications. Again, been around for a while. It has to be used very carefully. You click into the algorithm and it kind of tells you about a lot of people who you have to be careful about with that medication. And I think it's less used in current treatment protocols. Treatment for tension headache, and which tends to be a fairly chronic headache as well, really centers around mostly the over-the-counter medications, as well as a lot of lifestyle work. And in both cases, we're talking about lifestyle too. Good nutrition, physical activity, regular muscular activity to relieve muscular tension. Even people who have migraine can be triggered by sitting for long periods of time at the computer with that kind of bent posture and the neck strain going on. But certainly it is a precursor to the tension headache. So those are the kinds of non-pharm treatment modalities that we'll use in a traditional treatment protocol. Sorry about the flicker. That may bring on a seizure for some people. I apologize. Again, I think I already mentioned that the sinus headache is largely not really a sinus headache, but often called that by patients, and it is actually a migraine. In the not so common vein,
I always said George Malley has something extra to offer this world. I said that the day I circumcised him. Happy birthday, George. Happy birthday, bud. It's great. It's great. 37. Anybody see that? That light? There was a noise. Did you hear it?
Man's inebriated.
I'm not drunk. Can't sleep. And you? What's happening to you, George? Well, lately, things have been so clear to me. Just understand quicker. I just can't stop feeding myself. I read three books a day. Ever since the sighting. Roger, it was a damn light. Imagine doing what others only dream of. Uma coisa para ficar a melhor.
George, you learned the Portuguese language in 20 minutes?
Not all of it. Experiencing what others can't understand. And I'm trying to tell you that I think that there's an earthquake coming.
He's nice, isn't he?
Yeah, but he thinks he saw a UFO and he thinks he can predict earthquakes.
And believing what you never thought possible. Ooh, let me see you do that one more time. It's a damn mistake is what it is. It was supposed to happen to someone smart, but it didn't happen to me. You're watching so closely. I think I scared them.
You're not alone. People have been doing astounding things, things we can't explain.
Can't they just look in his eyes and see who he is? Is it close enough?
You tell me.
It's pretty close.
What do you mean by genius? He's basically off the chart. I don't think he's testable. If you think that's something, you should see him move stuff in spring. Would you love me the rest of my life?
No. I'm gonna love you for the rest of my life.
so that was a clip from a great movie made some time ago about a man who was an ordinary man and actually had a glioblastoma, and it caused some very interesting symptoms. He eventually dies at the end of the movie, very sadly, but it's a wonderful movie. He's a great actor, I think. Another less common and something that we want to consider in our older folks, ask me about my grandchildren, is temporal arteritis. Pretty distinctive in that you will feel, you'll palpate the temporal artery and they'll have tenderness there.